I mean, I was conned, okay? I'm a cardiologist speaking truth to power, calling out the manipulation of the drug industry for years, pre-pandemic. But I had a blind spot, I admit this, and to still some degree do have a bit of a blind spot, but less so now, on vaccines in general. I did not predict at all that any vaccine, I had no experience, clinical experience, I didn't know anyone who was vaccine injured before the pandemic, so I could not conceive of the possibility of a vaccine doing harm. And because of that reason, I was one of the first people to take 2 doses of the Pfizer vaccine. I went on Good Morning Britain in the UK to advise the public that it was likely safe. I didn't point the fingers, I didn't mandate, I didn't say we should be coercing people into it. This was just for people at high risk, for elderly people at the very beginning, before they changed the goalposts. And I went there and I said it's likely to be safe. And actually, when you compare vaccines to all the other things we do in medicine, and let me give you context here. Before the pandemic, one very credible estimate suggested that prescribed medications, what your doctor prescribes for you, are the 3rd most common cause of death after heart disease and cancer globally because of side effects. And then within that, vaccines are not even included, right? So what happened? Well, I took 2 doses, and then very quickly, and this is, we're talking about January 2021 when it's being rolled out across the world, people started to feel and know that there was something wasn't right. First of all, it wasn't stopping infection. We were told by the likes of Rachel Maddow on CNN and similar, presenters in the UK that if you get the vaccine, you're not going to get the infection, almost 100%, right? And it's important for you to have it because you're going to protect other people, especially elderly people. We knew very quickly, intuitively, because of the COVID, that people who were being vaccinated were getting COVID. Then, of course, people were getting harmed. There were reports, we were hearing about people dropping dead. They were being reported in the media as being very rare. But on the ground, people felt, hold on a minute, these are not very rare, something's not right, and people were experiencing side effects. So that gradually started to evolve. Then in the summer of 2021, my father, who was the vice president of the British Medical Association, who took 2 doses of the vaccine around the same time I did, who was very fit and well, out of the blue, he called me up. I remember it was a July the 26th. It was a hot day. I was in London. He lives in a city in north of England called Manchester, where I grew up. And he called me up and he said, Aseem, I've got chest pain. We talked through it. I said, Dad, you need to call an ambulance and maybe having a heart attack. He didn't seem like he was in extreme pain, but I said, listen, we need to get you checked out. I went to have a shower to get ready to get on a train to come up to Manchester to see him because I knew even if there was nothing acutely happening, he would be kept in hospital for monitoring and blood tests to make sure there was no heart muscle damage, etc. I called him back. There was no answer. I kept calling him, and then one of his neighbors, who was a doctor who'd gone to see him, answered the phone hysterically and said, Aseem, your father's had a cardiac arrest. We're doing CPR on him. I stayed on the line. And I thought that he would be fine because it was a witness cardiac arrest. They'd call an ambulance. The ambulance was delayed by 30 minutes. The ambulance got there. They FaceTimed me. They put the monitor on. It was a flat line. There was nothing to shock. He was gone. I was shocked by what happened because it didn't make sense to me. I'm a cardiologist. My special interest is in heart disease. I knew my dad's lifestyle inside out. I said, this doesn't make sense. We organized a postmortem for him. And when the postmortem came back, he had 2 of his 3 major arteries had severe blockages in them.